I am Dr. Thompson Ntuba Akwo, international physician, political leader, communicator, certified professional and expert in global health USA. Women's health, all maternal and reproductive health, and chronic diseases. There are many people who don't want to understand when we begin to talk about breast cancer. There are people who come into global health from the public health background. I'm in global health from the medical and surgical and community health background. Our community health department in the medical school was very, very good, and it was also a recognized center for research by the World Health Organization. And so I am very grateful to have gone to that medical school, because our public health, epidemiology, and all of the other related things, nutrition and everything, was done under community health. And then in community health, we had the opportunity, and we started at the preclinical level, where we're taken to certain cities out of a medical school city to do what we call community health, community-based experiences and services. And we came back and did presentations on community analysis of diseases that we thought were there, what we did, what we think that should have been done, and what we would have done if we were already medical and or surgical practitioners. And then we came and presented before the faculty and members of our different faculties in our university. And I love that. I love that. Because that aspect of health communication was there, was given to us, an opportunity to be able to stand before professors and all these dignified people with all the trainings from all these big universities in the United States, in Britain, Glasgow, and all these other places, and listening to us. That was good. And I used to say, wow, I want to thank my university, because they brought out the leadership in us. It is my university that made me to begin to aspire to be the president of National Union of Cameroonian Students in my university. And I was the first person from my region to be. And that gave me an opportunity to look at healthcare issues and to look at other things and to be a leader and what it takes to lead. Community organizing, community participation, community partnership as part of community health or global community health practice. And I continue to repeat to say thank you very much, because I believe that my formation was excellent, especially because I spent extra time here and there doing some of the things that I needed to do. That is why when I returned to my country, after working at the University of Ilorin Teaching Hospital as a senior medical officer, I like that also. Given an apartment, and it was nice. I thank you. And I pray and I hope that you have improved the quality of what's going on in the medical school. We may not have returned there. I've returned to the teaching hospital and talked to students under CMDA, the Christian Medical and Dental Association. So, first, because you are an MD or a medical doctor and a DR in front of your name. You see, what we did was a combined study of medicine and surgery. That is why our degrees actually show that we have a degree in medicine and surgery. But that is not when we became qualified physicians. We still had to do the internship. And while some people went to local communities and everything, I felt that I wanted my name to appear as a senior staff in the teaching hospital. So I applied to do my internship in the teaching hospital. And luckily I was admitted. So I did all the work in the different departments, from psychiatry to OB-GYN, obstetrics, gynecology, and pediatrics, and that. So it was great. So when I returned home and I began to work as the deputy medical assistant of Dr. Eben, a consultant who came from Glasgow and with all his experience in Douala and everything, It was another opportunity for me, not only experience-wise. And then from there, I began my own, what Beatrice calls a little clinic, which gave me the title of director of a medical institution, and out of which I had now the opportunity of sitting with my boss. You understand what I mean? Some people, oh, he's too smart and that. No, no, no. I just know what to do. Because if I did not resign, I would not have been called director of the clinic that I started. So, just to give you a little background of where I'm coming from. And after that, I began to fight because I began to enter health policy and things. And I was looking at the quality of healthcare and also the quality of the lives and, you know, the respect that the physicians were getting. So I called a few of my physician friends. And I said, oh, why don't we start a private providers association? And of course, they accepted. And I was ready not to be the boss of the organization. So you people saw in the city when Dr. Kwankam, a gynecologist, died, what we did and other things. And I began to tell the administration that if you want anything, you want the private physicians and pharmacists to participate, you have to come through us, the executives. First of all, you have to upgrade our status. We have to move from Tribune B in the public grandstand to Tribune A. Because I didn't see how people would first school, jumping from one place to the other, doing nonsense in the name of politics. We're sitting in Tribune A, and my boss, surgeon, a great recognized name, Dr. Eben in Cameroon, was sitting in Tribune B. And I was like, no, not really. Enough of that nonsense. So that's where I started. We are going to move all of these physicians to Tribune A. Condition number 1. Condition number 2. This and this will happen, that and that will happen. So I had begun to do advocacy at a very young age, around 30 and so. I was there. And then in my fight and everything, I became the national chairman for the elites of my state. And out of which I began to work with the Prime Minister. I was constantly hammering the Prime Minister in the Prime Minister's office, going to the Chancellor or Vice Chancellor's office, Dr. Dorothy Njoma, and telling her that, listen, we have enough of health facilities within Boya to use as the teaching hospital. Let the medical school go operational. So it was a big fight. And it's out of that as the government of the Cameroons wrote that, oh, he's going to participate in the HIV meeting in Toulon, and what he contributes and brings back is going to be a blessing to the country. That is good. And I remember when I started getting to Toulon for the HIV/AIDS symposium meeting, I began to see Dr. who I call Guru, Anthony Fauci. I remember talking to him and we're in the Escalier Roland, and I was like, hey, I'm so proud of you. I've read about you, I've heard about you, and I'm so happy that you are here. And he was just laughing, and I was like, oh, how about your family? He was like, oh, we are here. This one, and we're just going upstairs and we're just talking. I didn't know that I was going to come to America and work with Anthony Fauci and, you know, be asking him questions and be part of the NIH, some of the meetings, you know, especially the minority and disparity health issues and all of that. And then my work in HHS, and I've been to CDC and all of those places. Just to tell you that I have traveled to almost all the states of the United States working in the global health field. And I want to tell you, just as I told people at the American Cancer Society in Atlanta and other parts of the world, cancer continues to be a serious chronic disease that we need to take care of. And we can take care of it. And we thank all those who are contributing money in the campaigns, in the what we call the cancer runs. Some of them are walk and all of those things. Same with infectious disease walk in the global health area, health promotion and protection, the HIV/AIDS walk and runs and here and there around the world. Working with the Director General of the World Organization, Dr. Tedros, this past 2 years has been an enormous amount of time put. We had 2 or bi-weekly meetings on COVID-19, and then we had the meetings with the city. And then with the city, we're going to different places, Chief Acevado, Chief Pena, Dr. Pierce, Director Steve, our Congress people, and all the other people who were in and out. Dr. Kalenda, Chief Executive Medical Officer of the Memorial Hermann, one of the biggest hospital systems in America. So, I come to you to tell you about breast cancer, not from an everyday public health person, but from someone who brings all the disciplines, or most of the disciplines of global health. I used to tell Beatrice, oh, you know this one, and that. I'll be watching her doing the things in the courts, wanting to look at how she was doing. She didn't know I was studying and everything. And so bringing some law, anthropology, psychology, sociology. And those all in their own rights create a game changer. Susan Komen. We have worked with Susan Komen in Atlanta, in Washington, D.C., in Baltimore, in different parts of the world. And I want to say thank you, the pink people. Some of you will be like, oh, he's wearing pink because of Susan Komen. I don't know if that's why I'm wearing pink. If that's why there is pink around me. But I still remember that some of what we have is Susan Komen and the work that these ladies have been doing around the world. Mobilizing resources, doing the campaigns, the runs and the work that does not only contribute money and a platform and rostrum for experienced and expert speakers to tell the people about some issues related to breast cancer research, breast cancer prevention, breast cancer education, breast cancer treatment, breast cancer surgery, breast cancer spirituality. You know, there are lots of survivors who occasionally have a relapse, and they are afraid because maybe some friends of theirs have died after they were declared survivors, and they don't know what to do. In that situation, there is the need for the social and psycho-spiritual elements of it to be addressed. And I want to thank you, John Professor Graham, Dr. MD, PhD in theology, at the Texas Medical Center, the Institute of Spirituality and Health. Oh, I remember for almost 1.5 years, I studied at the ISH. And I thank God for Professor Graham. Yes, integrating spirituality in health. There are many of you who don't know that there is the need for people to be able to cope with some of the issues that they deal with cancer diagnosis, cancer treatment, cancer management, cancer survivorship. Families who are there to aid and to help them. People who are by them to say, oh, you can. Don't give up. Yes, you can. And so I wave this to all of you who in different cities in America, in the world, come together. You women who are providing resources, who are going alongside those great men who provide resources, millions, billions of dollars for cancer research. St. Jude, I thank you for that which you do with the kids. It is a great work that you are doing, and we are asking you to continue that work. Don't give up. Don't stay back. Don't hold anything back. continue to do that which you believe you were born for. I remember I was the keynote speaker for the blue, purple, something pancreatic cancer. And so the people were all seated and the bulbs and the lights were turned blue and the whole place was blue. And I remember when I was introduced by the boss, it was in the city of Houston, and I began to speak. And I was telling them how to actually make sure that they used the BPSS model, the biopsychosocial-spiritual model in the management of cancer. And I spoke and I told them about loved ones who can only be contributing to the work of fight against cancer because they were victims of cancer. I know there are pains, there are challenges and difficulties, but I told them that it is better for you to be diagnosed with cancer in the city of Houston than anywhere else, because I believe that the best cancer center in the world is the MD Anderson Cancer at the Texas Medical Center. I just said that. Or the medical city in Houston, the state of Texas, in the nation of the USA. USA. I want to say that we are beginning to have Nobel Prize winners out of the Anderson or MD Anderson Cancer Center who are competing with those ones from the northeastern side around Cambridge. Most times when I'm in Cambridge or Boston, you want to call it, and I'm at the Harvard University. I love the campus, some old campus. Many people call Harvard, but some of your universities have better structures and good structures and infrastructure than Harvard. But you know what? Harvard is still Harvard. And I thank you, those friends and colleagues in Cambridge, those of you with whom we meet at the convention center in Washington, D.C. and all the other places where we meet for the meetings. I want to say thank you. I've missed a lot of you because of COVID these past years. But let me continue to say that let it not only be the dancing and the festival during the Susan Komen campaigns, let it also be the listening. All those partner health institutions that bring their resources, tell you what they are doing there. So when you go for the Susan Komen meetings, look at all those partner organizations. Go to them and ask them, what are you doing? How different is it from others? Don't just be dancing and people talking and playing and drinking. When you run or when you walk, ask them how nutrition is related to surviving cancer, how nutrition therapy may be of help, chemotherapy, radiotherapy, mastectomy. For some of you, you've had radical mastectomy. Oh, but what do you mean? That's in surgery. And it's an extensive radical mastectomy where we remove all the breast tissue and go in there and even chop away the muscles underneath and follow them to the axilla and other places where we think that the malignant tumor cells may have seeded. Because when they metastasize, when they go out of that area and they begin to seed to other places, you may see people who die from a tumor just from the complications of the tumor. Maybe you have a brain tumor and it metastasized to the liver. And they got to know when they did a liver biopsy and they noticed that there's a tissue or cell that is there that is unrelated to the liver and it has to do with the brains. And then they begin to look for where did it come from and all of that. And then the studies say that it is a metastasized certain form of brain cancer or breast cancer. So do not forget to do your yearly mammogram if you are due by age. Do not forget the preventive measures when you go for the Susan Komen event. Try to make sure that you visit the different people who are doing work in that area. If we are not there with you, we'll continue to do and produce the resources.